everybody. It's a little before 5 on August 11th. We're coming to you here from the Opelika campus of East Alabama Medical Center. My name is Chuck Beams. I'm the Executive Director of Pharmacy Services here at East Alabama Health. I'm joined today by Dr. Michael Roberts. He is our current Chief of Staff. He's an intensivist and is the Medical Director for ICU. Also joined by Dr. Kevin Royal. He is a 25-year physician here in Opelika, practices right across the street at Internal Medicine Associates. And we want to come to you today and bring you some information that we think might help. As you all know, the COVID virus is surging once again in our area. And we wanted to bring you some information today that we think might help you if you're dealing with COVID at home. We want to talk about the current state of affairs. I want to talk about a little bit about what's going on in the hospital today. The statistics that you hear today, the numbers that you hear today, they are the numbers for today. So if you're watching this video, hopefully we're not in this in November and December, but if you're watching it then, these are the numbers for today. So we want to give you a little background about what's going on, and we're just going to have a conversation today that hopefully will give you some tips to help you. You may not be experiencing COVID today. I hope you are not, but you surely probably have a family member that is at home, a friend maybe that's home that's that is experiencing that today. So we want to give you some things that might help you. We brought some things here. You see some props here on the table, and we're going to talk about those. So I think maybe to start off, let's just talk about the current state of where we are today. And I thought maybe Dr. Roberts, if you could just kind of give us a quick glimpse of where are we?
Yeah, so today at East Alabama Medical Center, we have 44 inpatients with COVID-19. If you look back a month ago, so today is August the 11th, on July the 11th, we had 11 patients in the hospital with COVID-19. Wow. So we're quadruple the number over the course of the past month. And you can imagine the strain that puts on our staff and on our facility. Our main medical floor at the hospital right now is completely patients with COVID-19. Right. So we've seen things really take off.
And I think we all were kind of in the place where we were really expecting to kind of be kind of out of the woods, and life was kind of returning to normal. We've quickly had to pivot, with every facet of life to this. Are you seeing some of the same things in the office setting?
Yeah, Chuck, I think there's no doubt that the numbers have increased dramatically over the last, I'd say about 3 to 4 weeks in our office. We had a stretch of several months in the spring and early summer where we had little to no activity in terms of COVID patients. And now the number of patients we would see in a month, we're seeing that in a morning or an afternoon clinic. It's really dramatically increased in the last 3 to 4 weeks. So it mirrors what we're seeing in the statistics for our county. I think today I looked in the county test positive rate. Percentage of patients who test positive is 21%. That number was less than 3% earlier this summer. So a nearly 8, 9, 10-fold increase in the number of in terms of percent positive tests. So there is no doubt that the COVID activity has picked up dramatically in the last month.
Right. Anything else that you would want to add about the hospital? I mean, obviously you mentioned the fact that one of our medical floors is full. One of the things that really concerns me, and I think concerns us all, is all the normal things that keep us busy as a medical center and as a medical system, they're all still happening. People are unfortunately having heart attacks. They're having motor vehicle accidents. They're all the things that keep us busy. Those things are still happening, and so we're having to kind of make room for that as well. And so is that a concern to you?
Yeah, I think so a medical floor with 36 beds would typically have people with a lot of different problems, as you mentioned. So you might have somebody with a heart problem, with heart failure, or somebody with an infection, or somebody with a flare-up of their chronic lung disease, and those would all be things that we might manage on that floor. And now all of those beds are taken up by patients with one problem.
Well, and so that really is kind of the reason, and I'll just be real transparent. I was fully vaccinated in December and January, and about 3 weeks ago, I contracted COVID, and so I have no idea where I got it. It was very sudden, and so as I sat at home, even as a medical professional, I was sitting at home thinking, what is it that I need to be doing? I was really thinking, through the brain fog and all that kind of went along with the disease, and it got me thinking that maybe we should sit down like this and kind of try to give some information that would help folks, because ultimately we want to keep you out of here. We don't want you being here. We're trying to do everything we can to keep people healthy and at home. Most of the people that encounter COVID are fine. I mean, would you agree with that, Kevin?
Sure, sure. So, most people are going to do well ultimately.
Right.
But when we're talking about huge numbers of people who contract a disease, even a very small number of folks who end up severely ill in the hospital or dying turns into a big number over time.
Right.
And we've seen that in our country with hundreds of thousands of deaths attributed to this virus in the last 18 months.
Right.
I think Michael's point about normal medical problems occurring in the hospital on top of COVID is an incredibly important one. I try to tell my patients, people are still going to have heart attacks and strokes and have accidents and have appendicitis and have injuries. And we all want our hospital to have the resources that it takes to take care of those problems in an excellent fashion. And when we're dealing with a lot of COVID cases, it really, really puts an incredible strain on the staff and resources of our local hospitals. So one of the things we want to do is protect this institution so they can provide the same excellent medical care that we're accustomed to.
Yeah. I was talking to some friends in Dothan and Mobile over the last few days, and they're at that point. They're really having to make some tough decisions down there, and I just pray that that doesn't happen here. So that's why we're here. So let's just kind of talk through some of the simple things. Obviously, we can't just give broad medical advice to the entire 11 counties that we serve here in East Central Alabama, but there are some simple things I think that we can talk to folks about that really will make a difference. And so let's just kind of talk through those, kind of the treatment at home and some of the things that would be important.
Well, what I'd say, Chuck, is before treatment, I'd say prevention is the most important thing. The most important thing you can do is try not to get COVID in the first place.
Sure.
And the most important thing there is vaccination. Vaccinations are plentiful. They're readily available. You can walk into a pharmacy today and initiate the series of vaccines. Now, unfortunately, if you start a vaccine today, you can't expect to be fully protected for 5 to 6 weeks, because we don't say that someone's fully vaccinated, fully protected for 2 weeks after their second dose if they're using a 2-shot series.
Right.
So it's important to get it done as quickly as possible, because if you don't get it, you keep pushing that timeline further and further down the road. But they're readily available. They're very effective. I saw a statistic yesterday in a lecture that even though the effectiveness may be a little bit diminished with the Delta variant, a person who is vaccinated is 8 times less likely to contract COVID than someone who's unvaccinated. And the most important statistic is that if you are vaccinated, you are 24 to 25 times as likely or less likely to be hospitalized or die with COVID-19 than an unvaccinated person.
Yeah,
that's an incredibly important thing.
Yeah.
So those 44 patients that are in the hospital, 38 of them are unvaccinated. So, far and away, the patients that I'm seeing that I'm putting in the hospital are patients who have not been vaccinated. Our patients who have been vaccinated and are getting sick enough to come in the hospital, generally older than 70.
And that's an amazing number. Say that one more time. Say those numbers again. That's just it really is hard to imagine. Say the numbers again.
Yeah, 38 out of 44.
38 out of 44. So
the average age of a hospitalized patient with COVID-19 in Alabama right now is 54.
Yeah, which is way down from what we saw.
Way down from what we saw early. And then the other really important statistic is the ADPH has released data from the last 6 months. And since vaccines, the first people would be considered fully vaccinated. Out of all the COVID-19 deaths in the state of Alabama, 1% were vaccinated. 99% of the deaths in the last 6 months have been in unvaccinated patients. So extremely effective at preventing severe disease and death.
I will definitely take those odds.
For sure.
And it's disappointing. You had that disappointment. Hey, I'm a vaccinated person and now I've gotten COVID-19. That is disappointing, but that's sort of inherent in vaccine use. None of them are perfect.
Right.
There will be some breakthrough infections with almost any vaccine you
Right.
talk about.
Right.
But what we're trying to do is prevent severe illness, hospitalization, and death. And and these vaccines still fit that bill.
Right.
Absolutely.
In my experience was minor. Some congestion. I lost my taste, and that was the most aggravating part for me. I like to eat. So let's kind of move into the treatment and kind of some things that we want to do. One of the first things we talked about was stay hydrated, and you talk about kind of the importance you see about water. I've got a gallon of water here, and I'm gonna give it kind of a little simple formula that I think might help. I think most folks probably don't comprehend how much water it takes to stay well hydrated, and so talk about just hydration and how important that is.
Yeah, I think staying hydrated is certainly an important part, and it's one of the reasons people end up in the hospital is that they're feeling bad, they don't want to get up, they're not eating and drinking like they normally would, and even though in the hospital we actually walk a very fine balance between too much and too little fluid in our patients with COVID-19. Those are people who are very sick. Most commonly, I'm giving fluid when they get there and then backing off.
Right. I weigh 215 pounds. I wish I could weigh a little less, but take half of that weight, which is about 107 pounds, or 107. That equates to 107 ounces. This gallon jug is 128. So not all of that, but almost all of that. And so I know I don't drink that much water a day, and I know I probably need to stay hydrated more. So hydration is important. The other thing we were going to mention is stay active. Talk to us about that.
Well, one of the things that COVID does is it does increase risk for blood clots. And the more immobile you are, the higher that risk goes. So one of the things we want people to do is to be up and moving around. I mean, the temptation is when you feel terrible is to stay in the bed and just rest.
Watch Netflix.
And it's fine. It's fine to get some rest and try to recover. But at the same time, we want folks up and moving around. There's nothing wrong with getting outside your house and taking a walk if there's no one else around. There's nothing wrong with that. So we want people to be active because that helps clear out the secretions from your lungs when you're up and moving around. It reduces your risk of having blood clots in your peripheral blood vessels. So it's very important.
Right.
Yes.
One of the other things I brought is this Mucinex. I'm not being paid by the makers of Mucinex, whoever that is. This is just an expectorant. It thins mucus in the lungs, and it may, coupled with good hydration, can help, keep that mucus thin. And that's something that I picked up at the drugstore. And so the kind of going along with the hydration, temperature. Keeping a good watch on the temperature. What would you say about that and the importance of keeping an eye on your temp?
Well, I mean, certainly fever makes us feel really, really bad.
Right.
Now I would say this: a little bit of fever can actually be beneficial.
Right.
If your temp's 100 and you don't feel so bad, there's no need that you necessarily have to treat that. There's some evidence that perhaps your immune system is enhanced by at least a modest degree of temperature. Now, if you're getting to 102, 103, and you're feeling bad, there's nothing wrong with taking some Tylenol or some sort of other anti-fever medication. That's fine to do. Michael, what would you say?
Yeah, a lot of management, outpatient management of COVID-19 is symptom control, and I think managing fever is certainly part of that.
Yeah. Well, and the last thing I really wanted to talk about was this little device, and we're not necessarily saying that everybody needs to run out and get a pulse ox device. This is something that some of you may be familiar with. You can get these little guys in a pharmacy, just like you can get these other things. Let's talk about this pulse ox. There's people talking about this, and I'm testing my oxygen levels now. So talk about the importance of how keeping a watch on that could be a key to staying out of the hospital.
I think it's the main reason that we put people in the hospital with COVID-19 is that their oxygen saturations are low and they're requiring oxygen to keep them at an adequate level. So it is one of the primary decision tools that we use when we're trying to figure out whether we need to put somebody in the hospital or not. Hey, what's their oxygen saturation?
Right, and so it looks like I'm at 98. Kevin, am I gonna make it?
I think you're gonna make it.
So,
Chuck. What I usually will tell patients, if you're 95% and above, you can feel pretty good about how you're doing. 90 to 94, probably requires a little bit closer attention. If you're getting below 90, that's when we really start to get concerned, especially if that person is feeling very short of breath. In fact, one of the first questions I ask any patient that we diagnose with COVID is, how are you breathing? And if they tell me they're breathing great, I'm reassured almost immediately. Now, that doesn't mean that things can't change over time,
right.
And that's where a device like this comes into play. If you're feeling short of breath and you have a low number on this, that's when it's time to take action, either calling your doctor or if it's bad enough, coming to the hospital to get
right.
checked out in more detail.
Right. And these little guys, I think maybe $20, $25 at the pharmacy,
sure.
And maybe a good tool. One other thing, I think I said that was the last thing. One other thing is monoclonal antibodies. That there's been a lot of talk about that.
In fact, I would say in a patient who meets the criteria, that may be the number one thing we can do to treat them as an outpatient. And that criteria has changed. The age limitation has been lowered. It was 65. I think that's now 55 years old and above,
right.
Plus other conditions that might put you at risk for complications of COVID, such as diabetes, heart disease, hypertension,
right.
Immune suppressive disease or medications. All of those things make you a candidate for monoclonal antibody infusion,
right.
which the hospital is giving quite a few of in recent days.
We've given hundreds of doses, and really proud of the efforts that we've had here with monoclonals. I think it really has helped us stay, in a manageable state, And so I know you probably, I think the last time we looked at it was 4 or 5% of high-risk patients that got the monoclonal antibody infusion that admit, and those are just some incredible numbers. What else?
First, so 4 or 5% if they got the monoclonal antibody. That same patient population, if they did not, we're close to 30% hospitalization.
Right.
So I think through aggressively pursuing monoclonal antibody infusions here, just based on our local numbers,
right.
we feel like we've avoided hundreds of hospitalizations.
Right.
So that's very important.
Right. Well, I really appreciate you guys coming over. I know you both are just, in the throes of this. And, we hope that, I know this video is probably a little longer than we would like for it to be, but we wanted to almost kind of put together kind of a resource that you could use. Like I said in the beginning, maybe it's for now with a family member. Maybe it's something that you can use down the next few weeks or so. Our goal is to keep you healthy and keep you out of the hospital. And we pray for us here at the hospital. We're trying to do the best we can, and we know everyone's overwhelmed right now with we got to get through this again, and we are going to make it. And we appreciate you guys and what you're doing, and that's all.
Thank you, Chuck.
Thanks a lot.
Thank you, Chuck.